all of us have a family member, a loved one, a friend, who is impacted by falls. My own grandmother was 86 years old and fell, fractured her hip, and she wasn't really able ever to fully recover from that. So when we spoke to staff and providers about the importance of STEADI, we emphasized the fact that it's a common problem. It happens in every family, it happens in every community. We knew that we could institute STEADI because we had a physician champion who was passionate about the older adults in our community. He was someone who went to our senior leaders and said, this is an important initiative and it's going to make an impact on our community. We were able to integrate the STEADI workflow into our EHR. Took a little bit of work from our IT department, but we were successful in doing that. And the fact that it is in the direct workflow has made the process much easier. We definitely had challenges related to time and resources. Our providers and our clinical staff were concerned that performing the fall screening questions would extend the time that they would be spending in the room getting the patient ready for that visit with their primary care provider. Because we embedded the fall screening questions into our EHR, we were able to put it in the clinician's direct workflow. One of the ways that we've integrated the STEADI initiative into our day-to-day workflow is performing the screening questions during the Welcome to Medicare physical and the annual wellness visits that our over 65-year-old patients have with their primary care provider. Our nurse care managers and wellness coordinators follow up with our patients who screen at risk for falls to make sure that the interventions that are recommended by their primary care provider are followed through. We also had challenges related to the physical locations where we see our patients. Some of our locations are new and large, and some of our locations are more rural, and they have small exam rooms, small offices, so we needed to really customize how they initiated the fall screening testing. So we chose to use the TUG test in our fall program. We needed to have 10 feet of space in order for the patient to perform the TUG test. So we had to be creative. We had to customize the testing to each individual site, whether the testing was done in an exam room or we had to take the patient out to a private area in the hallway to get that done. We were able to do that on an individual basis. Our fall prevention team consists of our providers, our nurses, our medical assistants, our wellness coordinators, our nurse care managers, and most importantly, our patients. It's important for us to train and retrain our staff. So our staff who have been performing fall screenings for years need a reminder every once in a while about the importance of the STEADI initiative and making sure that they screen all of our patients annually for a fall. So it's important for us to educate our patients on why we're screening them for falls, what are the consequences of falls, and how to prevent those falls.